All right. Looks like we're live. I have a little bit of feedback. Are we clear? All right. Let me get started. I'm getting a little bit of feedback from somebody. I'm not sure. So if you guys just want to mute yourselves, that'll. All right, everybody, assalamu alaikum, and welcome to episode 4 of Balancing the Conversation. So, Balancing the Conversation is a series of conversations promoting open discourse on critical issues surrounding COVID 19. And on our last episode, we talked about the science and how the first step in the scientific method is firsthand experience. So we thought it would be a good idea to have a conversation with a frontline doctor to talk about their firsthand experience during the pandemic. And for those who are new to this project, my name is Lisana Valadez. I am a certified holistic nutritionist and founder of Nourished. And together with Dr. Mazina Tassi, who is a naturopathic doctor and founder of Forward to Health, we're going to be interviewing our very special guest, Dr. Syed Haider. Now, Dr. Haider attended the University of Florida on a National Merit Scholarship, then graduated with distinction in biochemistry from Shifa College of Medicine in Islamabad, Pakistan. He went to complete his internal medicine residency at New York Methodist Hospital in Brooklyn, New York, and he spent 10 years practicing hospital medicine and 5 years in telemedicine before focusing on COVID-19 treatment and prevention in the winter of 2020. To date, Dr. Haider has treated over 4,000 cases of COVID-19 with a 100% patient recovery rate. Dr. Haider is board certified in internal medicine with additional training in functional alternative and Chinese medicine. Alhamdulillah. So before we get started, I'd like to ask Dr. Mazin to start us off with an opening dua. I think you're muted.
بسم الله الرحمن الرحيم الحمد لله رب العالمين وأفضل الصلاة وأتم التسليم على سيدنا محمد سيد الأولين والآخرين وحبيب رب العالمين وعلى آله وصحبه أجمعين. نوينا التعلم والتعليم والتذكر والتذكير والنفع والانتفاع والإفادة والاستفادة والحث على التمسك بكتاب الله وسنة رسوله صلى الله عليه وسلم والدعاء إلى الهدى والدلالة على الخير ابتغاء وجه الله ومرضاته وقربه وثوابه سبحانه وتعالى. اللهم آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار. اللهم آت نفوسنا تقواها وزكها أنت خير من زكاها أنت وليها ومولاها. اللهم أرنا الحق حقا وارزقنا اتباعه وأرنا الباطل باطلا وارزقنا اجتنابه. وصلى الله على سيدنا محمد النبي الأمي وعلى آله وصحبه أجمعين. الحمد لله. أما بعد.
All right. All right, so Dr. Haider, so the first question I have for you today, just to kind of start things off, is what made you first decide that you wanted to go into medicine? So just tell us a little bit about your background.
Sure. So I was always interested in medicine from a young age, but when I was in high school, I didn't think that I had what it took to really become a doctor. I was just kind of looking ahead at all the training required, and 4 years of pre-med and 4 years of med school and 3+ years of training before becoming a doctor. And so that was quite daunting for me. And I actually chose to go into engineering at the University of Florida. I just didn't really like it. But it was in the middle of like the .com, boom. And I was really excited about, I think I was more drawn to making money fast, as a computer engineer or something. And I just couldn't bring myself to do it. I just didn't enjoy it. So I ended up actually dropping out of the University of Florida after a couple of years, and I just wasn't sure what I was going to do. And I was kind of depressed at the time and felt like I was just headed down the wrong track. And my father tried to come up with ways to encourage me to, I don't know, get out of this depression, right? So his idea was, why don't you go to Peru for like a month for this backcountry hiking, right? Get out of your head, get out of your surroundings, and get away for a while. And I was really excited. I was like, wow, that's a great idea. So I was training for this. I was jogging every day and everything. And I actually ended up spraining my ankle really badly and I couldn't go. So I was a bit upset about that. But then my aunt, she had worked in she was working at Shifa College of Medicine in Pakistan as a biochemistry professor. And so she said, he was always interested in medicine. we just started this med school a few years ago in Pakistan, and we have a lot of doctors from the US who came over to start this med school. It's a really great med school. Maybe you should consider applying here. And the nice thing about that was that you didn't have to complete pre-med before going to med school in Pakistan, because they integrate pre-med coursework into med school. So they make it 5 years instead of 4 years. And so I was still quite hesitant. I was kind of depressed and I didn't want to do anything at the time. And so my father framed it in such a way that kind of like tricked my brain into going ahead with it. And what he said was, if you get accepted, just try it for 6 months. And if you don't like it, you can just drop it. Right. And if you do like it, you can choose to continue if you want, but you don't have to make any commitment beyond 6 months. And so I was like, sure, I can do something for 6 months. It's not a big deal. So I did apply, and alhamdulillah, I got in, and then I loved it. I knew that I really enjoyed, the process of learning medicine from like the first month. It was quite clear to me that I wasn't going to drop out after the first month or so. And it was a wonderful experience, and I'm really glad I ended up doing it in Pakistan, because I got to reconnect with my Muslim culture, and that was also a big turning point for me, just Islamically and religiously. So it was overall a wonderful 5 years, and it really helped change the course of my life.
MashaAllah. So I'm getting some feedback. So when did you then move into the States and start practicing medicine in the States? So what happened in that period? Can you tell us how you made it there? Because we know that you worked in the hospital. So you worked in the hospital for 10 years. Which hospital did you work in? Can you give us a little bit more information on that?
Sure. So after training overseas, you have to complete the USMLEs, which are United States Medical Licensing exams. So I did a series of 3 medical licensing exams, and then in 2007, I started a residency at New York Methodist Hospital, and that was a 3-year residency. So I completed that in 2010, and then I started working. Most of my career was in what's called locum tenens medicine, which is part-time medicine, where you go around the country, you travel around the country, and help out hospitals that, for whatever reason, have openings in their schedule. They don't have enough physicians to cover. Sometimes it's while they're waiting to hire new people. So that was primarily what I did. So the first job was in Virginia, at Shenandoah Hospital in Virginia. It was a small town, and I was basically the one doctor in that hospital who was an internist or internal medicine physician. So I was covering the ICU, I was covering the floors, and it was a small, what they call critical access hospital with 25 beds. And so the buck stopped with me. Like if I couldn't do it, if I couldn't handle it, I had to either ship them out to a larger hospital. Or I just had to do everything there, and so that was a great experience. I think I stayed there for about 9 months, and then I just traveled all over the country. I worked in South Dakota, Indiana, North Dakota. I worked a lot in Virginia. I worked in South Carolina for some time. So all different kinds of hospitals. I worked at the Cancer Treatment Centers of America Hospital. I worked in long-term acute hospitals, which are places where if you're hospitalized with an acute illness and then you can't go home, you can't go to nursing home, you still need kind of acute care, you go to what's called an LTAC, or a long-term acute care hospital. So I've seen, all different kinds of hospital systems, huge hospitals with thousands of beds to tiny hospitals with, 25 beds, which is basically like the smallest you get in the United States. And, I've had the experience of working just by myself, or, with some consultants like surgeons and, critical care and cardiology. But like I was the only internal medicine physician, the general practitioner in the hospital, all the way up to working with, in places that have every possible specialty you can imagine and all the support that you need. And I've worked in poor communities, rich communities, so I've really had a broad experience of what medicine looks like in the United States.
Wow. So you got a lot of insights. So when we spoke before, you had mentioned that and that period. So with all the experience, you went all over the U.S. So you kind of became a bit, I don't know what word to use, but maybe like disappointed with the medical system. What aspect of modern medicine did you find troubling with that experience that you gathered?
Yeah, so I guess just my upbringing. My mother was always a bit, leaning towards the alternative medicine side. She was always interested in that, and I kind of got this interest from her. So that was always kind of in the back of my mind. But when you go through medical training, you're any kind of educational experience that lasts for years and is really intense. It's kind of, there's kind of a brainwashing element to it, right? Like you get completely immersed in a certain worldview, right? A certain way of viewing reality. So I don't think it's extremely difficult to escape that if you go through 5 years of intensive training in any subject. So, um, and, unfortunately, we don't have educational programs that are really bottom up, taught from an Islamic worldview, at this point in time. Even if you're in a Muslim country, and the hospital that I worked at or trained at in med school, they were, the physicians were quite religious and everything, but the textbooks and the training comes from a Western perspective. So there's not a lot of talk about higher levels of our being, right? And we're not grounding our practice in, the spiritual or even oftentimes the mental, even though we acknowledge that there is something, a lot to the brain and the mind that can cause disease, but we don't often focus on that. So there's a lot left out in medical education, not just the mental or the spiritual aspects of human beings, but also just nutrition, right? Like I don't really remember. Maybe you get like one tiny, maybe a day or two of nutrition, right, in med school. That's what I remember. I don't even remember it, but there must have been, a small little portion. It wasn't even an entire class. You don't get a whole class on nutrition. So you might get, a few lectures on nutrition. And the nutritional training that you do get is basically just, the FDA approved kind of stuff that comes, straight to us from large food corporations, and is basically just, it's not real nutrition. When you start learning about real nutrition, you realize that we've gotten way far off where we
Absolutely.
need to be with nutrition.
100%.
Yeah.
Well, people
I'm
are
sure you know about that. Yeah.
Wow. So again, when we were speaking before, you mentioned that in this journey of yours, you met an Ayurvedic healer in Jordan, and you learned a different approach. And the reason I want to talk a little bit about this is so people have an insight on what you gathered and how you brought it into your practice today. So can you tell us a little bit about that?
Yeah. So just to go back to the last question just a little bit, I did start kind of becoming disillusioned, disenchanted with Western medicine because what I saw was that we were basically treating chronic diseases. We weren't focusing at all on prevention or lifestyle changes, which, even traditional or, mainstream medical consensus is that lifestyle change can affect drastic improvements in maybe 3 out of 4 chronic illnesses, right? Like you can have drastic improvements in your health if you affect lifestyle change, and everyone knows that. We just don't focus on it at all. And again, in med school you don't really learn much about that either. It's like, maybe a lecture or two on exercise and stuff like that, and stress management. And probably even it's just not mentioned, right? Like you're focusing so much on acute and chronic diseases that you need to treat with medications, and so we're so focused on learning how to treat the things with medications that we don't take any time to acknowledge or wonder, like how can we help people who don't need medications, or how can we help people who don't necessarily need medications. And so in Jordan, what I learned with the Ayurvedic practitioner, he kind of helped this idea solidify in my brain that not only is lifestyle change extremely important, but it's the whole approach of treating chronic disease by using medications to basically blunt symptoms is just completely incorrect. And it's just at the very base of it, the approach is wrong. And the reason is this. You can kind of get an understanding of it. So the human body is extremely complicated. We think of it as a machine. We use whatever technology we have at whatever point of human development we've reached in history, and we kind of view the body through that lens, right? So like in the steam age, people would view reality and the universe and the body and everything kind of like a steam engine, right? Like that's how they would imagine it. And now, in the computer age, we think of ourselves as like a computer machine or something. And all of these metaphors for the greater reality and the reality inside our bodies are just way off the mark, right? So we don't really understand the nature of reality, and we don't really understand the nature of our own bodies and how they work. But what we do know is that if you were to, you look at it from the point of view of it being machine, it's more complicated than any machine we can even imagine is in our brains. We can't really understand how complex it is. So millions of chemical interactions all the time happening, right? And then millions of different organisms in this superorganism of our body, right? Bacteria, viruses, parasites, all kinds of things, contributing to our health. And so when we go in and we use with chronic diseases, we're basically, okay, so you have high blood pressure. Let's lower your blood pressure. That's such a simplistic way of looking at it, right? So what we know with chronic disease is that they're caused at minimum by like 10 to 30 to 50 different things, right? So like they're multifactorial the way we describe it. It's extremely rare to have a disease that's caused by just one thing, right? So acute diseases, yes, you get in a car accident. Car accident causes you to bleed. We have a direct causal relationship between one thing, right? Or you have like a infection with a specific bacteria causing you diarrhea. Yes, that one causal agent caused your disease. But with chronic diseases, it's not that simple. And even with acute diseases, it's not really that simple. But you can kind of simplify it. There's always going to be, what pre-existing conditions made you more prone to getting, a bacterial infection. That's always also part of the causal, framework that you have to look at. But for chronic diseases, certainly we know that they're multifactorial. Everyone agrees on this, and and so you're having, dozens of different causative agents putting your body in this disease state, this chronic disease state. And your body's responding to all these dozens of inputs, right? To be in whatever disease state it is. For example, your blood pressure goes up or you develop diabetes. This is a response. It's a cause and effect response but it's to 50 different things. It's not just one thing. So you can't treat it with just one thing, right? You give a pill to just force the blood pressure to go down. The blood pressure is going to force itself back up because all those causative agents have not been addressed. The root causes haven't been addressed. So the body wants the blood pressure to be up for whatever reason, right? It's kind of like when you stub your toe or when your hand goes near a flame, you feel heat, and the purpose of that heat is to draw your hand away from the flame so you don't cause tissue damage. It doesn't get worse and worse and worse. So if you had a human being who had no sensation, they wouldn't be able to survive, right? Like we need pain in order to survive in this world. If we don't feel pain, then we'll end up damaging ourselves just walking around, right? We'll stub our toe and it'll get infected, and we'll keep stubbing it over and over again, and then the damage won't heal, and you'll end up chopping off your foot because of the infection and the gangrene. So so chronic diseases are like that. They're a signal to you that there's something wrong, right? You feel sick, you start feeling worse and worse as you get older. You're supposed to wake up and wonder, why is that, right? Like, what is it that I'm doing that's making me feel this way? And so what we do with Western medicine is we put a Band-Aid on all of that, or we suppress the symptoms so you don't feel bad, right? So that in the background, underneath the bandage, the wound is festering, it's getting worse, and eventually, what I saw as a physician in the US was that, things are pretty manageable in your 20s, 30s, 40s, 50s, but as you get up into your 60s, 70s, 80s, these conditions become completely unmanageable. I would see patients in their 60s and 70s coming in with blood pressures that were like, through the roof, right? And completely uncontrollable. No matter what we threw at them, we would throw 3, 4, 5, 6 drugs, maximum doses, and their blood pressure would still skyrocket. I mean, it was just nothing we could do. And so this is the direction that we're pushing people. We're just worsening their problems, right? We're not actually making them better. And so you see this with whatever you look at, right? And I've written a little bit about this on my blog. So it's just, and so again, in Jordan, what I worked with Sidi Shabazz Ahmed. He was an Ayurvedic practitioner. And what we did, we kind of had a community outreach program where we went around, me, him, and an elder sheikh, went around the community, and we would, it started off just, the sheikh had some, acquaintances and family members and different people that he wanted to bring this, understanding of diet and lifestyle to, and also this understanding that you need to get off of your Western medications. And what I would, as the Western physician in that kind of, group, what I would go through their medications when we went to visit them. And I would find that these patients, I could show them almost always that, okay, this was the first medicine you started. It has this list of side effects, right? And in the chronology of your illness, you started having these other symptoms after that first medication, and you were diagnosed with some other illness that needed a second medication, right? And so I would show them that, here, look, you can see in the official list of side effects that, second thing, whatever it was, nausea or dizziness or whatever it was probably caused by your first medication. You were basically healthy except for one problem until you started that first medication. It triggered some side effects, and that's why they give you your second medication. And those two medications probably triggered some more side effects, and that's the reason you added the third medication. And a lot of times people looked at this and they were like, why did my doctor not even, consider that or tell me that? And they had been also kind of brainwashed in this, the doctors and the patients are together, unfortunately, brainwashed by our society into thinking that these drugs and this approach is necessary, right? And so they would, time and again, I would see that when we got them on a strict kind of like anti-inflammatory diet, just kind of like basic exercise program, good sleep, good nutrition, within like days to weeks, sometimes their symptoms would just vanish and they wouldn't need their medications anymore. So, the more drastic the lifestyle change, the faster you'll see results. And I mean, the most amazing results were seen with like stage 3, stage 4 cancer patients. So these people, and it wasn't just in Jordan, it was around the world, that would, Shabazz, he became kind of like famous, and the reason that he became famous amongst these, groups of patients, and they would just spread by, word of mouth, was that people had, severe cancer, and they were poor people, right? Like they couldn't afford, they would go to their doctor, and the doctor would, in these countries that don't have, proper healthcare, they don't have insurance, and so the doctor would say, you're going to need to, collect some money from your extended family. It's going to be like $100,000 operation or chemo or whatever. And these people just basically couldn't do it, right? Like in the US, a lot of people can afford this kind of stuff where their health insurance covers it. But in these poor communities, a cancer sentence is a death sentence, right? Like stage 3, 4 cancer is a death sentence. So there's nothing like that to encourage people to try anything, So Shabazz and myself, we would give them like a really, really difficult to accomplish programs, right? Like just completely get rid of all this junk that you're eating. And then, we use the Gerson protocol for juicing, and we kind of, he modified it and we added things to it. And we basically built on this old protocol from 30, 40 years ago, which was a cancer protocol of fresh vegetable juice, right? So people would be juicing 3, 4 times a day, and, getting rid of, grains, and getting rid of inflammatory, getting rid of pesticides as much as possible. And it's like a full-time job to do this. I mean, it's not a simple thing, right? And especially if you're doing it yourself and your family has to be invested in it, whoever's cooking has to be invested in it. And it's not easy, but it's worth it if you're about to die. And time and again, we saw people who were like at death's door, recover. And another, like an interesting observation was that their cancer would disappear, right? And you could see this on scans, you could see this sometimes. The cancer was actually apparent, like physically visible on their body, and it would go away. Or sometimes you would only see it on a CT or an MRI. But then not oftentimes, but sometimes people would fall off this program. So the program wasn't as strict as that. Once they were cured, quote unquote cured, it would become less strict. But there were some things that they just couldn't go back to doing, right? Like we would say, you really can't do some of these things that you used to do anymore. You really can't eat sugar, right? You really got to just, like, for the rest of your life, no more, right? And some people would go back to their old habits after a couple of years, and the cancer would come back actually much worse. And I've seen this with cancer, and I've also seen it in long COVID patients who have long COVID. If you don't really get rid of it, and it's a little bit different with long COVID, but if you don't completely get rid of it and you don't overshoot the mark and kind of overtreat for a few weeks beyond the point where you feel better, and then it comes back, it's actually oftentimes harder to treat for whatever reason.
Wow. So that's incredible. That's incredible insight. Dr. Mazen, do you feel similarly about Western medicine? What are your thoughts about it? Similar thoughts?
Oh my goodness. Yes, of course. And my journey was somewhat not similar. I mean, I was prepped and kind of groomed, maybe we can say, by my family and community to going into medical school and so forth. But I became disenfranchised very early and kind of took a break. And it was actually in the same or similar community as Dr. Syed Haider here that I came across naturopathic medicine with a mutual friend of ours. And within one night of a conversation, being totally redirected towards this type of medicine that I knew in my heart I've always wanted and yearned for, and I had no idea what it looked like, where it was. But I knew from following my father, who was a physician. My father's a cardiologist, and my grandfather was a physician in Syria. So and my community where I grew up in Indiana was a community of physicians. So I knew medicine culturally, socially. I knew the hospital systems. I knew outpatient clinics. I shadowed my dad. I knew all the nurses. They knew me. They knew I like soccer. They check in on me every year. How is soccer? How is this? So I'd spend time there and I'd listen. I'd observe. And I was curious. And I was really disenchanted, really around college time, where I was preparing to take my MCAT, and I was doing rounding and internships at the local hospital on campus or off campus, and just interfacing with the culture of physicians and just noticing that patients weren't getting better. I'd ask questions to the physicians about what they were doing, what was the treatment plan. I was getting into health and nutrition a little bit at that time as well, so I knew that was a very vital part of health and medicine, but I didn't see it being applied. I was really troubled by that. And there was something in my heart that I'm a very passionate person. I could not get myself to submit my applications. So after graduation, I ended up working in different fields and studying and really doing my own healing journey, really undergoing my own healing process at that time and becoming more spiritually kind of aware and centered and traveling and studying. And then when I came across naturopathic medicine, that was it for me. That was it was really just an invitation from Allah Ta'ala to really follow a path of learning, of integration, of synthesis, of the principles of Islam, of Islamic healing in a Western context, which was so important that, we can speak the language, that we can speak scientifically, right? So naturopathic physicians are trained in 4-year medical school programs. And the first 2 years are very similar to their MD and DO counterparts. So the same anatomy, physiology, pathology, immunology courses were the same. We have a very similar board exam. And that's very important for people, I believe, as a small digression here, for people that are trying to revive Islamic medicine in the West. You should be conversant in both, because you have to inevitably interface with physicians, with patients, with insurance systems, with the whole medical system in and of itself, which is set up in a certain way that you have to be able to meet it. You have to be able to speak the language of it. You have to be able to demonstrate a type of proficiency, a type of understanding that can build trust. And so there's this type of, this is why I wanted Dr. Syed Haider to come on this call, because it's so important that people realize that when I speak as a naturopathic doctor and as someone who practices holistic medicine about the system, I am not here denigrating allopathic medicine as someone on the opposite side. I'm not otherizing it. We have first principles, right? We have a type of medicine that is rooted in every traditional healing paradigm historically, right? There's a type of philosophy that is a common thread through Ayurveda, through naturopathic Western medicine, through Hikmah, Tib Yunani, through Chinese medicine, through homeopathy, through the indigenous medicines of peoples all over the world. There's a type of shared philosophy and approach. And I really want people to understand and respect that, right? And to see and contrast what the mainstream scientific medical model as it stands today is in contrast to that. When you shine a mirror to it, because it's very authoritarian in the way that it presents itself. It's hegemonic. We are science. We are truth. We are the arbiters of the standards of healthcare. And if you oppose that, then you are a heretic. We talked about this last week. But once you're able to really see in a principle foundational level what medicine should be, you should be working at root cause levels. You should be working with the whole patient. You should be educating the patient. You should be helping them prevent disease, not just manage symptoms, right? And to cure, right? So these are things that once you understand them, you can't, like once you see it, you can't unsee it. Once you know it, it's very difficult to not practice that and to not look for something better. And so this is the angle that we're trying to bring here. It's like, we're not here as holistic extremists and trying to take over, the government of allopathic medicine. Like, we're not doing that here. We're actually trying to restore something, trying to revive something that's true and life-giving in a time where people have totally lost hope, where people have totally lost any conception of things being better for themselves. Like, they're being told that this is terminal, you got to just manage it, you have to just polypharmacy the rest of your life, apply these different medications and stagger them in different ways to alleviate the symptoms as much as possible, but you're not going to heal. You're terminal. And, and it's not, they'll come to me like, people like me, and they'll be like, this is very manageable. If you're up for this, we can do this together. There is hope here. And this is a time that we need to bring back hope. So yeah, I mean, am I disenfranchised with the medical system? Absolutely.
Absolutely. Wow. That's passion. So clinging on to this hope that you're talking about, right? So we're here to give people hope. We're here to show them what is possible. So that moves us a little bit forward into Dr. Haider's history. So there's a point where you got into telemedicine, which is kind of going to bring you, what you're doing now. But when did you get into telemedicine, and when did you shift to start treating COVID cases?
So telemedicine, I was doing kind of off and on, part-time in between the hospital medicine since probably 2016 at least. I was working primarily with Teladoc, which is the largest telemedicine provider in the United States. And so that's kind of an urgent care model where the patient doesn't know you. They just have like a cough or a cold or a flu or a UTI or something minor. And they want to discuss it with the doctor online. So it's the first time they're meeting you. And then, when the pandemic hit, initially we were expecting, hospitals to be overloaded and me to be very, very busy. I was expecting to be working nonstop, during the pandemic. But then, what actually happened were lockdowns hit and no one wanted to go to the hospital because no one wanted to get sick or no one wanted to catch COVID. So like all the patients that I would normally treat in a hospital, they just vanished. They stayed home and they didn't get the care that they needed. And so surprising, interestingly enough, I said the care that they needed, maybe they didn't need it, actually. We saw a decrease in like cardiac deaths due to the pandemic, and no one could really explain that. I asked cardiologists, what do you make of that? And they were like, well, maybe there's less stress because they're not working. But on the other hand, I would think that they would have more stress because they're not working, right? And because of COVID. But, it was really a bit inexplicable why cardiac deaths went down during the pandemic. And, that kind of brings up one of the things I write about and talk about with Western medicine is that there's a lot of death and disease caused by even properly prescribed drugs, right? And it's been estimated to be as high as like the fourth leading cause of death, like properly prescribed prescription drugs, which is just shocking. And a lot of people dispute, that it's not really that bad. But certainly, there is, there's some, there are side effects and there are deaths that can be directly attributed to using medication properly, let alone actually the mistakes, right? That's a whole nother cause of death. There's hospital errors and mistakes that also cause disease and death, but we're not even talking about that. So anyway, I was working. So what happened when the pandemic hit was no one went to the hospital, and I actually had a job lined up in New York, and they were desperate. I mean, they were trying to get people for like double the normal rate. They were like, we need, as many people as possible. So I was set to go. Like I actually booked a flight to New York, like in a couple of days later. and then all of a sudden, like, they realized that they weren't getting any hospital. No one was coming to the hospital. They didn't really need any help, and this went on for months and months on end. So I just went like 100% telemedicine with Teladoc, and so sometime in the summer of 2020, I started learning about ivermectin, and this was before it had been publicized in the media at all, right? Like, no one knew about it. Initially people were using hydroxychloroquine, and I still think hydroxychloroquine is quite safe and effective. And it was just, it was given a black eye, and it was really, these fake trials. There were trials designed to fail. One, and then there were actually literally fake trials published, right, in the New England Journal of Medicine. They ended up retracting it, but the damage is done. You publish a trial and you trumpet it throughout the media. This doesn't work, or this is dangerous, or this is killing people. And then when you retract it, you don't tell anyone. You don't publicize it as much when you retract it and say, "Oh, sorry, that was completely fake. The data was completely faked. There was nothing true about it." But no one hears that part of it, right? Like, 99% of people get the story that it's bad and dangerous for you, and then when a couple of weeks later, a couple of months later, it's retracted. It's done like in the dark of night, right? Like, no one sees it being retracted. So that was the case with hydroxychloroquine. And it's still such a hot button issue, right? Like, first of all, it was like the Trump drug. Trump says, you should use it, so we all have to attack it. That was kind of the approach of the mainstream media and the left. And still, if I bring up hydroxychloroquine to like a pharmacist or somebody, they just think it's beyond the pale. I mean, they just will shut down immediately. They will stop listening to you, and they'll think that you're a crazy nut job for even considering it. And again, they don't look at all the data. But hydroxychloroquine is not as benign as ivermectin, certainly, right? Like, you can overdose it, you can overdo it, and you could harm people if you really tried. And that's what happened with some of these trials. They gave toxic doses and probably killed people during the trials just from overdosing hydroxychloroquine. So anyway, when I started learning about ivermectin in the summer of 2020, I started, first of all, presenting it to people on Teladoc who were coming to me with cough or cold or COVID, diagnosed, and I would say, hey, there's this medication, and I would try to explain to them about ivermectin, and I would just get a blank stare, like, what are you talking about? And literally only like 1 in 100 people that I presented this to were even interested in hearing about it. And I realized that you hear like this one doctor, random doctor online. It's the first time you're meeting him. You haven't heard about it anywhere in any media or from any family or from any other doctors or anything. You feel this like cognitive dissonance. It's like, this can't be right? Like, it just can't be right. There's no way there's a treatment for COVID-19 and I haven't heard of it, right? Like, 24/7 news cycle all day long, COVID-19. And then this doctor on Teladoc is telling me that there's a treatment for it or a way to prevent it. There's no way that can be true, right? That this is what people were thinking in their minds. And so their eyes would glaze over and they'd be like, what is he talking about? And the other thing was, ivermectin is kind of a weird, it's not like Tylenol that everyone's heard of. It's a drug that it kind of sounds kind of strange and no one's ever heard of. And then, you look it up or you tell them that it's used for parasites or scabies, and they're just like,
So, so what was the standard? So what was the standard treatment that people were used to when they were coming to you? If there is like,
this is the terrible thing about COVID-19, that there's really never been any treatment, right? And this is, people kept coming to me eventually, and it was just a bizarre feeling to go to a doctor and be given nothing, like literally nothing. Not oftentimes they would go to the doctor and they would be told literally do nothing, right? Whereas every other time in their life that they had gone to a doctor or an urgent care place with a viral infection, they would leave with something, right? Like, people expect you to give them something, and this has been a problem with Western medicine, for a long time, where doctors will prescribe Z-Paks, for example, which are antibiotics, and no one believes that they work for the cough, and yet they're prescribed left and right for like coughs and colds, where the doctor's giving them out. If you ask them, like, is this going to work for a viral infection? They'll say, no, it doesn't work for viruses, right? It'll work if it's a bacteria, but you probably don't have a bacteria, but here you go anyway. And so doctors have always done this, where they're kind of like, the patients expect something, and they've become convinced that a Z-Pak works for them, right? Like, somebody will come with a sinus infection, and they're like, I need a Z-Pak, azithromycin. I need that. That's the only thing that works for me. And so, it's possible to take something and to get better, and you would have gotten better no matter what you did. So we do have to approach COVID-19 the same way, right? So like it's certainly possible that I'm giving somebody ivermectin and they're getting better, but they would have gotten better anyway. So there's this apparent cause and effect relationship, and it's just really a correlation, right? This famous saying that everyone throws around: correlation doesn't equal causation. Certainly, you have to keep that in the back of your mind until you get more data and more proof that there is actually a causal link, in healing. So people, usually would go to the doctor expecting something, some at least for symptoms, right, to manage their symptoms. And in many cases, they would be told, "Don't we can't give you anything for this. Just go home and wait. And if you get better, great. And if you don't get better, come to the hospital, right, or come back to us if you can't breathe, basically, if your oxygen starts dropping." And so just people had this bizarre experience. I mean, I had one elderly couple who went to the urgent care, and the doctor was like, "Sorry, I can't give you anything for this." And then as they're leaving, he hands them like a card, and he's written my phone number on it, and he says, "Call this person, he can help you." Right? And so they came to me, and they were just so like confused. They were like, "Do you work for the urgent care? Is this like a referral? I mean, like, who are you?" Right? I mean, he didn't really explain it to them. So a lot of people just had this strange, and I, at the same time, physicians like myself were looking at what was going on, and it was just like, this is a bizarre situation that we're in. We've never experienced anything like this before, where we're being told you cannot prescribe off-label, medications, where we prescribe off-label medications all the time, before we have, 100% proof that they work. There's like a plausible reason why they might work. You look at their biochemical action in the body. Okay, this has antiviral effects, for example, like ivermectin. It has anti-inflammatory effects. Maybe it'll work for COVID because it's a viral and inflammatory disease. So medicine is always done like this. Doctors always start treating with things, quote unquote, off label, where the FDA hasn't approved them for a certain indication. And it's done all the time. I mean, with newborns, something like 90% of what we give them is off label or not, quote unquote, proven to work. But, you give it and you see it work enough times, you don't really need any more proof than that. So the same with COVID-19. I mean, the people who are using it on the front lines, I mean, I was using it basically with telemedicine, but there were people in hospitals using it. There were people in ICUs using it, and they could see, it was just, the proof was in the pudding, right? Like you used it, like you went from not using it to using it, and all of a sudden everything changed, right? Like the experiences of the patients and your experience of the illness completely turned around and was completely different.
Do we have data that backs up these experiences, what the doctors were witnessing?
Yes, absolutely. So with anything, anything in medicine, you go through certain stages of data. So like I was saying before, there's a biochemical, mechanism of action that we know about for a drug. And so when COVID hit, people, they went looking for drugs that might have a mechanism of action that we knew about that might work for COVID. And so ivermectin was on that short list of drugs. And so we actually had data going back to 2012 in test tubes showing that ivermectin worked against coronaviruses, right? It worked against flu viruses. So we knew it had antiviral effects. And then it was actually tested against COVID-19, and it showed antiviral effects in tissue cultures, for COVID-19. And then it was used in animals, and it showed antiviral effects and anti-inflammatory effects in animals, showing that it probably worked for COVID-19. And then it was used in human trials. It was, there were observational trials where you look back where there were epidemiological studies, there were randomized controlled trials, double-blind randomized controlled trials. I mean, the very highest level of evidence that's demanded has been, applied to ivermectin and shown, and it's been shown to work. So there's really no argument anyone can make against ivermectin because every single possible study has been done already. And it's not just one randomized control trial, which would have been enough. It's, there's something like a dozen randomized controlled trials that were done, and another dozen observational controlled trials. And even if we hadn't gone that far, even if we didn't have randomized controlled trials, which are considered the gold standard of evidence nowadays, there's been a lot of research showing that observational studies or observational controlled trials are equivalent to randomized controlled trials. Like, you don't get different data from them, right? If you have a bunch of well-done observational controlled trials, you really don't need to spend millions of dollars on a double-blind randomized controlled trial. And so I think, everyone in evidence-based medicine has been kind of brainwashed by pharmaceutical companies that the only way we can get to absolute truth is by spending millions and millions of dollars. And that's just not the case, right? Like, that's not true, right? But everyone kind of believes this, that evidence-based medicine requires this. And of course, I mean, it works out great for major billion-dollar corporations if the only acceptable truth in medicine requires, them to exist and them to invest millions of dollars and then turn around and charge you, huge amounts of money for their new medications, their shiny new drugs.
So the doctors, I think we talked about this when we were speaking before. Are they familiar with this data? Because we have a lot of physicians who are just not prescribing, they just don't believe that it would work. There's a lot of, articles. I mean, I can pull one up, talking, badly about this drug, ivermectin, that it's only for people who have worms, and the pharmaceutical industry, the pharmacists are in our communities are buying into this, right? Because they
Yes.
hear their physicians, right? Can you give us a little bit of insight on this?
Sure. So everyone goes through their life with certain basic kind of like rules to simplify things, right? Like they've shown, some people may have had this experience where you're driving home from work or something, and then you get home and you don't remember any of the drive, right? Like it just like passed and you were in a daze, right? You just weren't aware of what was going on. So, once you learn something, how to do something, you just offload it to your subconscious, basically, right? And so this applies to a lot of different things. Like we have these heuristics or these like programs or these like rule sets that we apply to our lives because we just don't have time to like study every single thing, right? Something new comes along. In medicine, the basic approach of 99% of physicians is, what does the FDA say about it? What does the CDC say about it? What does the NIH say about it? And 99.9% probably, or even more, of physicians in Western countries are so at a loss for time that they have offloaded almost everything to these organizations, and they trust that somebody smarter than them or a committee of people as smart or smarter than them, experts, have evaluated all the available data with intellectual honesty, and they have pronounced that it's either something you should use or you shouldn't use. And so I have not found yet any physician who has said that you shouldn't use ivermectin who's actually looked at all of the data for it, right? I've had patients take sheafs of paper about ivermectin and printouts from the FLCCC, which is the Frontline COVID Critical Care Alliance. They have a website, flccc.net, where you can find all the data on ivermectin, right? Like they've done a great job. They've built out a frequently asked questions section. They have like a review of all the data that you can print out, and it's easy to read and understand. They have a one-page review of the data, right? Like really easy to look at, right? Like any doctor should be able to look at it. That one page should be enough. If you look at it, with an open mind, it should be enough to at least go and look at the 30-page review of the data, right? The more, detailed review. And then from there, if you still have questions, you still have doubts, start digging into the studies yourself, right? Like this is what should be done, and it's not done. And the only way I can explain it is, I don't think that people are evil, at the basic level. 99% of people, they think so there may be evil out there, but people think they're doing the right thing, right? And so most people believe in what they're doing, and one way you can explain things like this is the only way somebody can reach the level of an FDA commissioner or the head of a pharmaceutical company or even being a scientist in a pharmaceutical company is because they believe in what they're doing, and their research backs up the results that the pharmaceutical company likes to see. And so you kind of funnel into these positions of power people who all the incentive structures work to get these certain kinds of people into those positions of power. They have a certain worldview, they have a certain like educational background, they have certain belief systems, and they're able to produce certain results, right? And so it's not fair or equitable, and it's not like you're not drawing from the entire breadth of humanity, and we're not getting a diversity, right? Like, this is a buzzword nowadays. We don't have a diversity of opinions or backgrounds in any company or any organization. People all come from the same background, and so and now, even going beyond that, not only those organizations have no diversity of opinions or backgrounds or beliefs, but the diversity of opinions that you would find usually on social media have been suppressed, right? All these people have been kicked off, and you're only allowed one opinion and one belief system, right? And so we're not going to be able to find truth when you don't allow a free market in ideas. We will never arrive at truth when you have governmental fiat, right? So fiat is governmental decree, right? The government decrees that you must use this money, right? And that's probably the root source of a lot of evil in the world today. Is this fake money that we use? That in the U.S. it really, when we went off the gold standard in 1971, you see rise in crime, you see rise in single parent families, you see incredible rises in wealth disparity. So everything you can go back. Anytime the government gets involved in forcing your hand to do something, usually you're going to find a problem there. So now we have fiat medicine, right? We don't we start off with fiat currency. Now we have fiat medicine. It's medicine by fiat. Medicine by government decree. The emperor says that you must do this, and every doctor has to fall in line. That's what we're seeing nowadays. So I kind of gotten off track, I think. Where did I start here?
So would you say that you mentioned that these, the FDA, the CDC, the WHO, who
Right.
is telling them what to recommend? Are they reliable sources of information for the public?
So, I unfortunately I don't think they're reliable anymore, and the reason, you can point to different reasons, but again, the proof is in the pudding. What are they recommending? And I know that they're wrong. I mean, I can show you that they're wrong. If you apply, the criteria that they use to give their recommendations fairly, to ivermectin and fluvoxamine and remdesivir and these other molnupiravir, the drugs that they've recommended that we use, vaccines. If you apply the same criteria to the drugs that they're saying not to use, you can see yourself. Anyone can see for themselves that they're untrustworthy, right? And you can, and so they're obviously untrustworthy. There's no doubt about it. They're not giving us trustworthy recommendations, and that's readily apparent. You can just go and look at the data, and you can convince yourselves of it. Anyone who's college educated can, within an afternoon, convince themselves that there is a double standard being applied nowadays by governmental organizations. And then you can go on to well, why is that the case? And there's a lot of reasons for it. One of the main reasons is regulatory capture. So the pharmaceutical companies actually fund the FDA. They pay for the FDA's budget, and people at the FDA, they oftentimes will leave the FDA and then go on to multi-million-dollar jobs in the pharmaceutical industry. So there's a revolving door between private industry and the government regulator. And so this, unfortunately, can be applied to our entire government. We have corporate capture of our entire government. So we really have a corporatocracy. We have, this is Mussolini's definition of fascism, that the corporations are in control of our government. So we really have a fascist system, and this is fascist medicine. And I think we need to call it out, and people need to understand that there's corruption at every level. And again, not to say that people are inherently corrupt or they think what they're doing is wrong, but the system itself is corrupt, and we've allowed corporations with their biases, their inherent biases, to take over our medical system, and so we're getting medicine which is in many cases harming us. Remdesivir is, even the WHO recommends against using remdesivir, and our FDA recommends for it. I mean, it is killing people. I mean, nurses telling me they see people die. They go on remdesivir and they die, right? There are thousands of deaths from remdesivir, and there are 0 deaths from ivermectin. There are, molnupiravir is the latest, COVID pill that's been given an emergency use authorization. And the data for molnupiravir is really spotty. I mean, it was studied in something like 10 different countries, and 9 out of 10 had negative results. 1 country had positive results. I mean, if anyone looks at that, they should have some doubt about whether or not this actually works. What happened in that 1 country that showed that it worked? Who knows? But even still, so maybe it has like a 50% risk reduction to use molnupiravir. Sounds great, but fluvoxamine in its phase 3 trial shows like a 90+% risk reduction, and it's not being used. It's not being recommended. So they're just using a double standard.
Right. So speaking about fluvoxamine, I just want to go a little bit back and tell us how you were treating people for COVID. So how is a medication like fluvoxamine, which is an SSRI, and it's used for depression, how is it used to treat COVID?
So, I just want to acknowledge that when I first heard about fluvoxamine, it was from one of my patients, actually. She said, you need to look at the data for fluvoxamine. And, I'm interested in getting a prescription for this in case I get COVID. And I just kind of brushed her off because I have an inherent, like, predisposition against SSRIs. I really hate them. If you are considering an SSRI for depression or anxiety or something, you really need to read a couple of books, before you decide to go down that path. You need to read The Emperor's New Drugs, and you need to read Anatomy of an Epidemic. Those are just required reading for anyone who's been prescribed an SSRI for chronic use. So they're really, really, really bad drugs for psychiatric purposes. And so I would never use it if it was going to lead you down that path of psychiatric disease, basically worsening psychiatric disease over the course of decades. But Steve Kirsch, he's an independently wealthy tech entrepreneur who's retired now, but he's spent millions of dollars trying to prove that fluvoxamine works. He funded the trials himself, right? And people told him if you get a phase 3 study, it's going to be recommended, right? And that's not the case. He got the phase 3 study through. I mean, it was delayed by months and months. They weren't publishing it. Finally, he got it published, and they just have still refused to put it on the guidelines. So he called me up. I was listed on a bunch of websites as a doctor who was willing to prescribe off-label medications. So he apparently went through those websites, and he was contacting doctors. He was trying to get the word out in maybe February of 2021 of this year. And he was at that point, we already had a bunch of studies and enough data to be nearly certain that fluvoxamine would pass through its phase 3 trial. And we already knew, probably even in the summer, I just didn't know about it, but we knew in the summer of 2020 there was enough data that fluvoxamine was effective. So initially with COVID, the alpha variant, ivermectin was more than enough, right? Like we didn't have to go down to second, third order drugs. But unfortunately, the pandemic has worsened and worsened, and what we see is that people get really sick. They're getting sick faster, especially with Delta. The illness comes on much faster, and they deteriorate much faster. And now, Pierre Corey, he's one of the heads of the FLCCC. He's telling me that in ICUs, he used to see 9 out of 10 people recover when he gave them everything that he knew they needed. And now it's the reverse. He's seeing 1 out of 10 people recover in once they get to the ICU phase of the illness. Medications still work early on, and that's when you need to use them, which is one of the main things that I want to stress here is that you need to have a medicine cabinet with a treatment kit. If you haven't had COVID-19, if you've had COVID-19, you're immune to it. That's one thing that's being downplayed in the media and by governments is this, natural immunity is extremely robust, so far. You don't get it again. If you haven't gotten it, or if you've been vaccinated, you need a treatment kit, right? Because vaccines are not, entirely protective against the disease. And even, in the first couple of weeks after a vaccine, your immunity is actually suppressed. And there's a lot of deaths and illnesses in the first couple of weeks after vaccines that are coded as unvaccinated deaths, which is really unfair, it's just not the right way to look at it because you got to look at an intention to treat analysis, right? You gave the vaccine and then what happened, right? Like you got to lump in the side effects and the downsides of the vaccine with the supposed or, with the upside that you're, arguing for. So regardless, where was I?
The fluvoxamine, like how it's used. Well, I guess we can move forward a little bit because you've treated at this point over 4,000 patients, right? With what is you're following the FLCCC guidelines. So what are you using, and have you had any hospitalizations? Has anyone died?
So my experience, and this could just be luck of the draw, but the first 20 people I treated for acute COVID infection, I just used ivermectin. And one lady who was in, I think, 60s or 70s, out of that first 20 patients, she ended up in the hospital before getting better. And then I started using fluvoxamine. And then my personal experience was the next 1,000 patients that I treated for acute COVID, no one ended up in the hospital. Overall, I've treated probably at this point probably 4,500 at least acute COVID patients, and there have been 5 hospitalizations. And looking at the hospitalization rate for COVID-19, I should have seen more than 300 hospitalizations in 4,000 patients, right? I should have seen at least 4, if not more, deaths, and I didn't see any deaths. Everyone recovered. Should have seen probably more than 2,000 cases of long COVID with a 4,000 patient base, right? Like we're seeing long COVID in anywhere from 30 to 60+% of people who get COVID-19, and I very rarely have seen long COVID. I mean, maybe like a couple hundred people or something, and you can avoid that if you treat really early. I have people come to me late, or I have people come to me as they get sick, and then it takes them a few days to get their medications because there's problems with the pharmacy, or you have to ship it in, or whatever it is, or it takes them a day or two to get through the just signing up and registering and filling out forms and stuff. So my personal experience, and that's just acute patients. I've also used it as prevention, and for prevention, it's, in my experience, extremely effective. Just going back to acute treatment though, real quick, in the 80+ age group, I should have seen 1 out of 5 deaths. Okay, or sorry, 1 out of 5 hospitalizations. I should have seen nearly 20% of those people hospitalized. I don't have exact numbers for how many people I treated over 80, but I didn't have any hospitalizations above 80. And one way you can look at it is, for example, in the fluvoxamine trial, fluvoxamine can cause some side effects. It can cause some nausea. And if you're not really convinced it's going to work, if you're not sure if you're on it, if you think you might be on a placebo, whatever, you have some nausea, you think it's from COVID, and you don't take your medication as prescribed, right? So there was, in the people who took at least 80% of the doses they were prescribed in the fluvoxamine phase 3 trial, there was 1 death in the treatment group and 12 deaths in the group that was on placebo. So it had a really huge effect in people who actually took it as prescribed. And so you would expect to see even better results if people really adhere to the treatment really closely. And that's kind of what I think my 80+-year-old population did. They were really worried, right? They came into it extremely worried that they would get sick or hospitalized, and they took it to a T, exactly as it was prescribed, and they got it right away, and they took everything I gave them, right? Whereas some people would just take ivermectin and not fluvoxamine because they have this inherent bias against SSRIs. And sorry, I think I skipped answering the question about how an SSRI would work in COVID. And so it does have anti-inflammatory effects. It prevents the release of serotonin from your platelets, and the platelets just dump huge amounts of serotonin into the bloodstream, which has a severe inflammatory effect on the walls of your arteries, and which causes your lungs to become extremely inflamed, and you develop pneumonitis basically. And so you can just cut that thing short. You can prevent that from happening. And even if it does happen, it still affects the sigma-1 receptor, which is an anti-inflammatory receptor in the body. So, there's 2 ways of treating COVID-19. There's kill the virus or prevent it from replicating further in the first 1 or 2 days. That's your window of opportunity. And if you miss that window of opportunity, you just need anti-inflammatories and specific kinds of anti-inflammatories that work in specific ways, like ivermectin. It inhibits nuclear factor kappa B, and that's like a main source of inflammation. It lowers cytokine levels like interleukin 6, and then fluvoxamine, its effect on the sigma-1 receptor, and steroids also. Steroids are kind of like a broad spectrum immunosuppressant, right? An anti-inflammatory drug. So I would try to avoid them if possible, right? If you don't get too far along, you want specific, like targeted, treatment instead of just like broad spectrum suppress your entire immune system kind of treatment, which steroids gives you. And so there's a number of drugs depending on. So I think the FLCCC at this point has incorporated basically everything that I use. Cyproheptadine, nitazoxanide, dutasteride, spironolactone. There's a lot of medications that have been repurposed because of specific effects that they have on the body that help you with COVID-19.
So when you were treating, your patients, I want to talk a little bit about the backlash that you received, right? So, what happened when you were prescribing, ivermectin or any of the other drugs that you were prescribing, when your clients, or I'm sorry, your your patients would go fill their prescriptions? What was going on?
So pharmacists would just refuse, and pharmacists and physicians have historically had this relationship where a pharmacist will oftentimes catch something, right, that a physician missed, and they'll call up the physician or send them a fax and be like, "Hey, did you realize that there's this drug interaction, or so and so, right? Did you realize such and such about this drug? And maybe you should lower the dose, or maybe you shouldn't give it. Maybe you should give something else." And a physician will call the pharmacist back or reach out back out to them and say either, "Oh no, I didn't realize that. Thanks for pointing it out, and I'll change it." Right? So there was this camaraderie and this collegial kind of like relationship between pharmacists and physicians, and sometimes I would send a prescription to a pharmacist, and it was something they'd never heard of before, and they would ask me about it, and I would send them like a paper or something like, "Hey, this is why I'm prescribing it, because of this, right? This is the reason. This is the data. This is the proof that it might work. I'm giving it off label, but I have something to back it up, right? I have a reasoning behind it." And I never had a pharmacist say, "No, I refuse," right? Once I gave them my reason and I showed them the data. But with COVID-19, pharmacists just flat out refused. They didn't want to read the data. They didn't want to look at it. And so patients would go there, and they couldn't get their drugs from the pharmacy, or the pharmacy would call me and be like, "I don't like the dose. You have to lower it. If you want your patient to get it, you're gonna have to give them half the dose," right? And this back and forth, and so it was quite distressing for me and for patients that they couldn't get it. And then pharmacists would start reporting. They started reporting me to my medical boards, complaining against me. And so I had medical board complaints, and anytime you get a medical board complaint, the board has to follow through and like investigate. And that's, it takes time to like respond to a medical board complaint from my end. I mean, it takes at least a couple of days. You have to review the chart if there's a patient involved, and you have to write, your answer, and you have to get it, run it by a lawyer and make sure you're not saying anything wrong and you're giving them all the information they want. And so like every medical board is different. You have to talk to a lawyer in that state who's familiar with their procedures. And so it's expensive and time consuming and stressful, because if one medical board, happens, you happen to get somebody at that medical board reviewing the case who, decides to escalate it, it can become much more time consuming. You might have to travel there in front of them. Thank God, alhamdulillah, that didn't happen with the one major medical board complaint I had. They just, dropped it after the first response. But it took a lot of my time, and it took a lot of money to respond to it. And then I had another medical board complaint in South Dakota. I had another one recently in Arizona that I have to respond to now. And, so multiple medical board complaints that take a lot of time and are stressful, because if one medical board has a problem with your license, all the medical boards learn about it. And then you have a problem with every medical board, right? And I'm licensed in like 30, 40 states at this point. And so, the amount of headache that they can cause you is just phenomenal. And the worst thing was that patients just weren't getting their medications when they needed them, right? So like a delay of even a day can have a huge impact on the development of COVID-19, right? Like you can go from, if you every day you wait, in medicine we have this saying that time is brain. When somebody's having a stroke, you can completely prevent the long-term effects of a stroke, right? Like somebody wakes up and they don't wake up, but they suddenly can't move their arm, right? They realize, I'm having a stroke. They call the hospital, ambulance comes, takes them to the hospital. You have a brief window of opportunity to use a clot busting drug and regain the use of your arm, right? If you miss that window of opportunity, every minute that goes by, you have brain cells dying, right? Your chances of recovering full use of the arm are dropping every minute that you wait to give that drug. And so with COVID-19, it's the same way, right? Time is your life, right? Like every moment that you wait, your chances of getting through this without long COVID or without hospitalization or death are diminishing, right? So this was extremely frustrating, and for me as a physician, talking to these pharmacists who weren't giving my patients the drugs that they needed on time. And so what we had to do is we had to find pharmacies all over the country that were willing to ship in the ivermectin, and we had to really shift to like focusing on trying to get the drugs into people's medicine cabinets as a treatment kit before they get sick, right? Like this is the only way to end the pandemic. It was ended in Uttar Pradesh in India this way, by getting the drugs into everyone's hands. People just went out to all the villages and they just gave out ivermectin everywhere, right? Every single person in that state in India got ivermectin. And we see this in countries like Brazil, Peru, like different countries, different parts of those countries or cities or states of those countries, got rid of their, outbreaks of COVID-19 by using ivermectin. And nearby states or regions or countries that didn't use them didn't get rid of their outbreaks, right? Like, so those were the epidemiological studies where you saw a group of people just, a few hundred miles away from another group, and they had completely different outcomes because of ivermectin. Um, so, um, so it's really important that you get the medications beforehand. And so, that's unfortunately what we had to do was in some cases ship in medications. And when you're shipping in a medication, I mean, it's going to take time too, right? It's not an ideal situation. Um, so, so in the beginning, it started kind of small, like we could still get it through to a lot of pharmacies. People, CVS had like these coupons in the beginning that made ivermectin a lot cheaper than anywhere else that you could get it. So we were really kind of pushing people to use a GoodRx coupon at CVS, but then CVS basically just stopped allowing it, and Walgreens stopped allowing it, and it just spread to more and more pharmacies. That the more the government got involved, the pharmacies, I think, were being called up by, they were getting emails and stuff by the pharmaceutical boards. Doctors were getting emails by the American Medical Association, and so it became this, when it was seen that the prescriptions for ivermectin skyrocketed during Delta. This is when it happened. Before the Delta wave, we had no problem with ivermectin. Everyone was extremely opposed to hydroxychloroquine because it had been publicized so much and so negatively. But ivermectin wasn't on anyone's radar screen. But then in Delta, we saw prescriptions for ivermectin just shoot through the roof around the country, right? There were people using ivermectin at thousands of times more than they were before. And then it got on, on the radar of mainstream media and the NIH and the FDA and the CDC, and people started tweeting about it, and people started talking about it in the news articles and news media and on television, and trying to disparage it and call it a horse drug and a dewormer, and what are you guys doing? And just taking things out of context, right? Like I got an email from the American Medical Association in with the American. It was from the American Medical Association, American Pharmaceuticals Association, and one other group. And they sent out an email explaining why you shouldn't use ivermectin, right, to all the physicians in the country. And it was just taking things out of context. I mean, it said things like, if ivermectin could cause, coma and death, right, neurological illnesses, and really, like, if you overdose on anything, it can cause that. But ivermectin has never caused that in a COVID patient, right? Like, it's never caused coma or death or anything serious in a COVID patient. But they take these things out of context and just try to scare people, right?
So I guess the question is because if you Google, ivermectin, some of the first results that you're going to get are why you should not use ivermectin to treat or prevent COVID-19. What we should be asking is why are early treatments being suppressed?
Why are they being suppressed? So I think, people have to understand how things work in the world, right? Like, we cannot be naive, right? So what actually is happening behind the scenes is that you have marketing departments of pharmaceutical companies developing all, like a packet of anti-ivermectin propaganda, and they distribute it to all the news outlets, and they distribute it all around the country to all the reporters, and they make it really easy for them. They're like, you want to write something, that's going to save people's lives. Here's all the research, all wrapped up with a pretty bow for you, right? And you can basically just create an article overnight, right? That is referenced and appears to be very professional and everything because all the work's been done for you by somebody who has a bias, right? By a pharmaceutical company who has a drug in the pipeline, an oral drug. They have vaccines, right? So the agenda at play here is that we need to vaccinate everyone in the world, right? Bill Gates went on television and he said, we're going to vaccinate everyone in the world to end this pandemic. He didn't say we have to. He basically said we're going to, right? So there are these pronouncements made by non-physicians, right? Or by physicians who are really bureaucrats, right? Who head up, the federal government bureaucracy at the FDA or the NIH or the CDC. Non-practicing physicians, or literally non-physicians, software magnates, making these pronouncements about public health. And the Bill and Melinda Gates Foundation has an outsized impact on global health. The global health agenda, basically, right? They're the primary funder of the WHO. So their entire focus is on vaccinations, right? And it was like that even before the COVID-19 pandemic. The WHO has stopped really focusing on clean water, and clean air and good food and anything that has like, these things have the main impact on disease, right? Like in the pre-vaccine era, right? All these infectious diseases, the death and disability and morbidity from them were all dropping precipitously due to improvements in, public health, which were primarily improvements in sanitation, right? So like, you improve sanitation in a country and deaths from measles, mumps, rubella, everything, right? They drop like a rock. And then we started vaccinating people against all of these infectious diseases. The deaths and mortality and morbidity kept dropping, right? But it really didn't change. So, people have argued that, maybe the vaccinations really aren't that important for all these other things that, these other illnesses, vaccines aren't as deadly. Like certainly you're going to hear case reports and stories of people who've been injured by vaccines, and it's always been the case. But with COVID-19, the vaccines are tremendously more harmful than any other vaccine in history, right? Excuse me. The reports in the vaccine adverse events reporting system in VAERS, just if you look back at the last 30 years for every single vaccine that we've ever given, all of the adverse effects and deaths from all vaccines combined are like a small tiny fraction of what we're seeing in 1 year with COVID-19 vaccines. So there is a vaccine agenda here at play, and that's because and people they have this misconception about philanthropy, right? Again, we cannot be naive, right? Like Bill Gates has gotten richer and richer after he started giving away so much of his wealth, right? Like he hasn't gotten poorer. He gives away $3, $4, $5 billion a year, to his foundation, but it's almost like an outsourced, R&D department, right? Like it's funding things that actually end up, benefiting companies that he owns, personally, benefit, the research that he does into vaccines that benefits vaccine companies. He's an owner of vaccine companies, right? Like it's just a circular thing. And so like not having to pay taxes, is great. And it also helps rehabilitate, your image, right? Like, you're seen as like a monopolist, and a lot of negative media portrayals of some of these philanthropists, and then they start giving away money, and all of a sudden they can do no wrong, right? And they're a media darling. So there's a lot of just sleight of hand involved, right? It's like these we're being fooled too much of the time, and if you start digging deeper and just use common sense and don't be naive, right? Like don't there are people are biased, right? Like if there's a lot of money to be made in something, it's just going to corrupt people, right? And again, they're not going to think that they're doing something wrong. They're going to convince themselves because their salary's on the line, right? That they're doing the right thing. Or it's just going to select for those people who believe that is the right thing to do. And the people who don't believe it are going to end up being naturopaths instead of being MDs, right? And the people and the MDs who kind of figure out what's going on are going to, turn into naturopaths or start veering away from this. But they're certainly not going to become, commissioners of the FDA because, once they realize, that, once the gig is up, you're not going to continue. And if you do, then certainly that is, just pure corruption, right? But a lot of times the people who are involved, they truly believe in what they're doing, but the entire system and this of incentives and the structure of the way that these the money that's involved, the billions of dollars involved, they direct our public policy down a certain path, right? And our medical policies are directed down a path where our medical policies enrich pharmaceutical companies, and they don't actually enrich our health at the end of the day. So our entire government has been taken over by pharmaceutical company interests, or at least the the portion of it that applies to medicine, the FDA and the CDC and the NIH. So this is the main problem, that there's an agenda at play here that gets in the way of using off-label cheap medications, and it's a multifaceted agenda. There's different levels of it. Like Merck was the company that created ivermectin, right? And they came out with a statement that no one signed. I mean, it wasn't like a scientist or a group of scientists put their names to this, but they said that there's literally no evidence that ivermectin works. And then a few weeks later, they publish, a press release saying that they have a drug in the pipeline for COVID-19, an oral drug, right, which competes against other oral drugs like ivermectin, their own drug, ivermectin. So, I mean, people just need to wake up and not be naive. That's the main thing, right? Like, just look at this. I mean, these are snake oil salesmen. That's all I can say, right? You need to just don't be so gullible, right? We have to stop being gullible.
You had firsthand experience with this backlash. Tell us a bit about, you were recently deplatformed from Twitter, right? We had a session here. One of our first sessions was about censorship. And I just want people to see how this is actually happening. This is our doctor. He's in Frontline. He's treating people. He was deplatformed. So these are not things that people are making up. It's not a conspiracy theory. This is happening. Can you give us a little bit of insight on what your experience was when you were platformed? Because you expressed that it was just kind of polarizing, right?
Yeah, it was sudden. I was speaking freely. I wasn't self-censoring. I had never been on social media. I don't think social media is really a healthy thing to do. So I never got involved with social media until a few months ago, and then I had been on Twitter for maybe 4 to 6 weeks or something. I had a few viral tweets, and I was just saying what I believed about vaccines and about ivermectin and about all of these issues. And then one day, I don't know what it was. I think maybe somebody reported me or something, and they just basically kicked me off with no warning. So I was this whole time when I started tweeting, I was thinking that maybe they're going to send me a warning or something, right? Like maybe I'll start to self-censor because otherwise I'm going to get kicked off. But there was no warning. I just got kicked off with and just irrevocably kicked off, right? Like you can't come back from it, and you can't do anything about it. There's no one to complain to. And other people have been kicked off. Steve Kirsch was kicked off right after me. Other people were kicked off, and so what this creates is an atmosphere of self-censorship, or an environment of self-censorship. No one is saying what they really believe because, doctors like that doctor who sent me the patients from the urgent care, he could have written a handwritten prescription for ivermectin, right? And he didn't. And there's a lot of doctors who got in touch with me and they said that my, the hospital that owns my practice will not allow me to prescribe ivermectin. Dr. Pierre Corey's compatriot, the other head of the FLCCC, Dr. Paul Merrick, he was treating COVID-19 in his hospital until recently, and the hospital management basically has now told him you can no longer use these medications, and he's taking them to court, right? I mean, even physicians who are willing to prescribe in hospitals are now being blocked in hospitals by the pharmacies who are not giving them the drugs in the hospitals either. So pharmacists aren't dispensing, and physicians, their hands oftentimes are tied. Like they will lose their job and they won't be able to provide for their family. And the same for some pharmacists, right? There are some pharmacists who agree with this, and corporate just won't allow them, right? And what option do they have? They can continue to help people as much as they can in every other area, right? Or they can lose their job and not help anyone, but take a stand, right? So when you threaten somebody's livelihood and putting food on the table for their family, this is what's happening with the vaccine mandates, right? Like a lot of people are getting vaccinated when they don't want to because they feel they have no other choice, right? They have to keep working. They have debt, right? They need to keep getting their paycheck. I mean, so most of this country, they don't have enough money to survive for even a month without getting their next paycheck. So people are they're held over a barrel and they're just forced to do things sometimes that they don't believe in, and they're if you put yourself in somebody's shoes, you can usually understand why they're doing what they're doing.
Wow. That's a sad state of affairs. So we have a few questions here from the public, and one of them is really good. It says it seems very hard to get our hands on these medications. So what can we do to get access to them? So basically, we have an audience from all over the world. People are going to be watching this video later on. Where do people go to get prophylactic treatment? Prevention.
So again, like you said, it depends on where you are. I know a lot of people around the world get it from India Mart, and it doesn't require a prescription. You can look up, basically any medication. Very few of them require prescriptions. The COVID drugs do not require prescriptions on indiamart.com. So it's INDIAMART.com. you got to try to do as much due diligence as you can with that place, because it's just got like a bunch of ads for drugs from pharmacies all over India. So, if you can, call them up, kind of make sure that they are regulated and they have, whatever approvals they need to be a pharmacy in India. But I have had patients who have gotten drugs from there, and told me that, like, for example, a long COVID patient took a drug from India Mart, and she said that I could tell that I felt better, right, like right away with this medication. So that is one possibility, and it's not too expensive. The only issue is that there's a lag time, right? Like, it can take 3 to 4 weeks to get the medication, depending on where you are. Um, and some people, unfortunately, their customs will block it, right? So I had a patient in the UK who had to jump through a lot of hoops, but she went ahead and did it. She wasn't able to pay at the pharmacy in the US without getting like a US debit card, so she had to like somehow sign up for a US Visa card or debit card or something, and then she used that to pay at a US pharmacy that shipped it to a forwarding company, which was ship7.com. So there's a bunch of these kind of forwarding companies that will forward. A US pharmacy is not going to ship it to you in overseas outside of the US, but they'll ship it to an address with your name on it. And if that address can then forward it to you, that's a possibility. Or you have like somebody in the US that because actually in the US we have sources of ivermectin and other medications that are actually cheaper than even India. So like really one of the best places to get it is from the US. Like my practice personally, we've called like hundreds of pharmacies around the country, and we've been able to source like the very rock bottom cheapest ivermectin. And there are, those are the pharmacies that still have ivermectin on hand from before it became very expensive, because now, it's been used up around the world, and, the new supply is actually much more expensive. So some pharmacies, it's not that they're jacking up the price or, trying to make money off of people. It's just that they've run out of the cheaper earlier source that they had, and they had to buy it again. And when they went back to their supplier, it was just, 10 times more expensive. So it can be expensive in some places. I mean, I've had people who paid like $1,000 for a 3-month course of prevention, taking it twice a week for prevention. And I've had other people pay $100 for the same exact thing from a different pharmacy. So my website, you can reach my website from mygotodoc.com or drsyedhaider.com. They go to the same place. So that's mygotodoc.com. So there is a fee to use my service. If people really can't afford it, you can ask for a discount, and we can, in some cases we'll even just do it for free. We're not, if you cannot afford it, just tell us, and we won't charge you. So that's one option. In the US, myfreedoctor.com, they also don't charge people at all. But people can make donations if they would like. And then and the FLCCC at flccc.net, they have a whole list of doctors that you can find for based on which state you're in, and that's one resource. So people in Canada, in Australia, in England, and the UK are having a lot of trouble getting these drugs, and so either you have somebody you can have like myself or another physician prescribe you a drug to a US pharmacy. If you have a family member, they can go pick it up for you, right? Like you don't have to actually go to the pharmacy yourself to pick up these drugs. You can have a family member go and pick up the drug that's in your name for you and ship it to you. And I would say, like, put it in a vitamin bottle or something, right, so that it doesn't get stopped at the border. Repackage it in something else, right, into vitamin C bottles or something. This brings up one thing that, sometimes, it's extremely hard when you're in a hospital to get treatment for COVID-19. I mean, I've tried calling hospitals and talking to the doctors, and it's just, you run into a brick wall. You just can't do it. So people end up smuggling in these drugs, to their, if they can even get into the hospital room, they sometimes smuggle them in. But if all else fails in a hospital, you just got to say that you're depressed, and say something like, I used Prozac or fluvoxamine once in my life, when I was younger, and it worked really well for my depression or my anxiety or whatever. And you can social engineer your way into getting fluvoxamine or fluoxetine. They both work very similarly. Fluoxetine is Prozac in a hospital situation if you really have to. And the funny thing about that is really that, like, physicians should not be prescribing SSRIs for depression in the hospital. If it's acute depression that hits you in the hospital, it's a new thing. Like, the technical guidelines would say don't do it, but everyone does it. So, like, this just brings up again this double standard that physicians prescribe things all the time against guidelines even, right? Like zithromycin and SSRIs for depression. When somebody has a heart attack or they get hit by a car or a bus, or they have diabetes or they have pneumonia or something and they're really sick. I mean, part of being really sick, you do feel kind of depressed, right? Like that's just a natural element of illness. And so you're not supposed to, treating depression is for like organic depression that is not linked to a secondary cause. Like if your spouse dies and you're depressed, you're not supposed to treat that with an SSRI. And again, everyone does anyway, right? They do it even though they're not supposed to, because it's like appropriate to be depressed in certain situations. It's not abnormal, and the drugs actually don't work for secondary depression that's triggered by something else, when you're supposed to be sad or when you're sad because...
Sorry to interrupt. I think a theme that I'm picking up here is basically taking ownership of your health. Advocate for yourself. And with my background in the U.S., it's hard when you're low income. I was a single mom for a long time, and you can't afford insurance or anything. You have to do these kind of things. It's like a norm. And why people don't stand up for themselves, it's like they feel they don't have the intelligence to. They shouldn't ask the doctor, influence the doctor, suggest to a doctor. And just the story is reassuring that you can advocate for yourself. You can request medications, stick up for yourself, because no one's sticking up for you right now. The government's not sticking up for you. It's you, right?
Absolutely. So just let's take one step back, right? The one thing that I missed pointing out is that vitamin D is really probably the most important thing, because anyone can get their hands on vitamin D, right? Like, if you can't afford to check your vitamin D level, just start taking, a few thousand international units of vitamin D every day. It's hard to overdose on vitamin D unless you take mega doses like 50,000, 100,000 daily for months. I mean, it's not that easy to overdose on vitamin D. You can take it with vitamin K2 as well to make sure that the calcium doesn't end up in your arteries. It goes to your bones where it needs to go. So vitamin D plus vitamin K2, they work together synergistically to put calcium into your bones. And vitamin D also has this effect on your immune system. So it bolsters your immune system. And studies were done, they've been done over and over again, showing that vitamin D, if you mega dose on vitamin D, you give like right at the start of COVID-19, it has a tremendous impact on ICU stays and death, right? So like they gave it to hospitalized patients right at the beginning, and high doses, 100,000, 100,000 international units at the start of an illness. Even if you have a normal vitamin D level, you can still take it at the beginning of an illness. And so vitamin D is very, very important, and everyone can get it. And what I found actually in brown and black communities, especially in the US, vitamin D levels are extremely low. Okay. So I worked in a primarily black community once, and every single hospitalized patient was low on vitamin D. I did not find a single patient who came onto my service in that community who was African American who did not have either low or oftentimes undetectable vitamin D levels. Okay, so especially the darker your skin is, the more important it is to supplement vitamin D. Sunlight on your skin is where you get vitamin D from. Plus, you get it from your diet. You get it from fatty fish. But it's extremely important for your just general health, and also for natural immunity to infections and viruses. So everyone can do that. Actually, if you come to my website, I do have like a free ebook. It's like a really short little ebook. It's not very long, not really heavy on the words even. And it just gives you the over-the-counter things that you can do yourself right now for prevention and for treatment and even for long COVID, right? So all those things, at the very, very minimum, you got to get your hands on vitamin D, vitamin C, zinc, quercetin. So these like 4 or 5 things are just extremely effective. Even, there's even some nebulized things that you can do at home. You can get a nebulizer machine and learn to take diluted iodine and hydrogen peroxide for the lung symptoms of COVID. People have had just tremendous benefits from that in the acute and even long COVID symptoms. I mean, it sounds crazy. I mean, really, if a medical doctor heard me saying this, right, like they would just like, what are you talking about? Nebulized hydrogen peroxide or iodine, but it works, and it's really low levels. It's not toxic, it's not harmful or anything, but it has a tremendous effect on the virus in the lungs.
If I can jump in here, I would be remiss also not to mention that homeopathy has been used from the beginning of this pandemic to great efficacy. And I mean, homeopathy has a history of being used in epidemic diseases from the 19th century, the 20th century, Spanish flu. There's whole books and articles and treatises written by homeopaths who had experiences that, lost marginal numbers of patients compared to 30-40% of what the regulars were using and losing.
Yeah, I just want to point out here, I just want to point out here that, some people just completely discount homeopathy. Some people this is just complete BS. It's like placebo effect or whatever it is. Even if it's placebo effect, right? Even if it's just a sugar pill, placebos are still very powerful, right? So this brings me back to something that my friend Shabazz Ahmed in Jordan said kind of close to the beginning of the pandemic, that this is really primarily a pandemic of fear, okay? Like fear itself is killing a lot of people, right? And causing a lot of disease. And if people just believe that what they're getting is going to help them, even just that belief, right? Even if it's like the belief that I'm taking something that's going to help me, even that can have an effect, right? An extremely powerful effect on your outcomes. And so that's another actual drawback to double-blind randomized controlled trials. The doctors don't have this belief that what they're giving you is going to work, and the patients don't have this belief that what they're taking will help. And so we're actually divorcing, medical science from a lot of the effect that bedside medicine has on patients, right? Like a major source of the effect, like with antidepressants, like something like 99% of the effect is a placebo effect, right? So like that was one of the purposes of me telling you to read those books if you're ever going to be put on an antidepressant for the long term, is that, what the authors of those books suggest, especially Irving Kirsch, and he says that his belief, and I believe it as well, is that the antidepressant has an activated placebo effect. So the patient realizes that they're getting the antidepressant because they feel side effects from it, and they're like, "Oh, this can't be a sugar pill because I feel nausea from it," right? So the knowledge that it's the real drug that they got in the trial, that gives them slightly better outcomes from the people who got the literal placebo. But the people who get the placebo have like a 30% improvement, and then the people who get the real drug have like a 30.5% improvement or something, right? Like just a tiny bit more above the placebo effect. So the placebo effect is very powerful, and it just points to the fact that we are not machines, right? Like you have to treat somebody's heart and mind, and you have to, like, the doctor at the bedside has to give them like just faith, and the doctor has to come to you and be like, "You're going to get better," with like complete and utter conviction. I'm sure you're going to get better. I've treated thousands of people with this exact same thing. I'm absolutely sure you're going to be better, right? And I have never really had this experience outside of like Hakims and people in other countries. Even medical doctors and other, like Western medical doctors in other countries will sometimes have this like calming, like bedside manner where they tell the patient, "Don't worry, you're going to be totally fine. I've got you. You're going to be fine." In the U.S., we have this like culture where everyone's worried about being sued, and I have to tell the patient like all the possible pluses and minuses, and I have to leave them feeling completely uncertain whether this is going to help or not, right? Like sometimes you go through this informed consent thing, and the patients are left with like just kind of a hint of the fact that the doctor wants you to do A instead of B, right? Like and this is not actually helpful, so going back to a traditional kind of medical approach where you the purpose of medicine is to help the person, right? The purpose of the doctor's role is not to like give them information that may harm them, right? Or may decrease their faith in the therapy, right? Like that's at the end of the day actually helpful for them, right? So certainly if there's a chance of harming somebody, you have to give them that up front. You have to tell them up front that, for example, with vaccines, we've gone actually back towards this approach where this paternalistic approach of like, just take the vaccine. It's perfectly safe and effective. Don't worry about it, right? And we've actually reversed this whole trend in Western medicine of telling people, giving them a truly informed consent and listing like all the side effects, right? Like all the possible things that could happen, right? We're not doing that just for vaccines. Again, this double standard in Western medicine, whereas with most things, with everything else, people are telling you, this might happen, that might happen. It may work, it may not work. The chances of it helping are 30%, and the chances of it harming you are 5%. But when you're giving somebody something that's extremely safe, like ivermectin, fluvoxamine, these things taken for a couple of weeks, I mean, their safety profiles are just so high, right? And if you do have a negative effect, you stop taking it, that effect goes away, right? It's not harming anyone. So I feel perfectly comfortable telling people, take this and you're going to be fine, right? And especially but you got to take it right away, right? Like you got to stress to them, hey, don't just be laid back and relax and take it whenever and take, a little bit or whatever. Take exactly what I'm telling you. Take it exactly how I say. Start as soon as possible, and inshallah you'll be fine.
So, can you tell us what is the best thing families can do? So, as a family unit, to protect themselves from COVID in the first place.
So yeah, again, just being healthy, right? This is something that's not focused enough on, and I'm so glad you asked me. Just making sure you're not overweight. That's the number one thing, right? Getting healthy to begin with. Getting rid of inflammatory foods, getting rid of inflammatory seed oils, right? Like canola oil and all these junk oils that we're fed. Getting rid of processed food, right? Eat whole food. Eat real food. The more whole your food is, and the more wholesome it's going to be for you. But like what I mean by whole foods are foods that are not highly processed. So processing is chopping up, that's processing, right? You can process a salad by chopping it, but it's not highly processed. It's not powdered, it hasn't been pulverized and turned into like a liquid or a powder, right? Powdered sugar, the ultimate in processed food, like that's the extreme. That's as processed as you can possibly get. Giant chunks of brown sugar, less processed, right? But still, unprocessed would be sugar cane. You chew up the sugar cane, right? That's unprocessed. So you want as much possible unprocessed, healthy food in your diet, if possible, organic. If not, just wash it really well. And look up the dirty dozen and make sure that you're avoiding the foods that are the worst of the non-organic foods and trying to eat the ones that have the least amount of pesticides. With vegetables, it's less important to use organic than it is, using organic meat, right? So like meat, animals concentrate pesticides in their fat. So
Yes.
like if you're going to spend money, a limited budget on food, it needs to go like the meat has to be the highest quality meat in the world, right? You need to get the best quality meat. The animal was treated properly, it was slaughtered properly. It wasn't sad. It wasn't depressed. It wasn't full of stress hormones its whole entire life. It wasn't abused. So the meat has to be really good quality, and you're gonna, if you have a limited budget, you're not gonna use as much meat, right? Maybe it's going from everyday meat to once a week meat, right? But at least it's not gonna be harmful to you. The meat has to be grass raised. So anyway, I mean, we're getting maybe beyond the topic, but just you got to be healthy. You gotta lose weight. You got to eat right. You got to get out in the sun every day, get some sun. You got to make sure your vitamin D is okay, or just take vitamin D. Eat some fatty fish 3 times a week. Have good family ties and good relationships with your friends and your family, and make sure you maintain those ties, right? Like that has a huge impact on our health, is just like social ties, right? Like close social ties that are healthy and happy and not, dysfunctional, right? So if you have dysfunctional family ties or social ties, you need to fix that. There was actually this incredible study. I think it was done maybe in Pennsylvania or something by Harvard researchers, I think, years ago. And it was a town, I think, of Italian immigrants, and they just had like really close family ties. They had like multi-generational households, grandparents, parents, children all living together. And this was just like the norm in this town. And they did everything else wrong. They ate the wrong stuff. They smoked, they drank, they did everything possible wrong. They had stress, nothing right except this one thing. And they had like half the risk of heart disease as age matched controls in the rest of the country who didn't have the family ties that they had, right? So family tie, just little things can have outsized impacts if you really maximize them, right? So so if you maximize everything, then the impact it can have on your health is just tremendous. So you have to get prepared. We're surrounded by stress in the modern world. We live away from nature, right? So you need to get outside more, right? And you need to do something to manage your stress every day. So people say, I'm not stressed, but everyone has some amount of stress coming in. And so everyone needs to learn some qigong or some yoga or some breathing techniques and just do them like for 5 minutes every day, no matter what, and just make that your baseline routine and like ramp it up if you feel more stressed out, and So those are the basic things, is just make sure you're healthy. And then once you've got, those bases are covered, you've got your vitamin D, you've got all your vitamins and everything, then you need to get a COVID treatment kit. And even if you're relatively low risk, so the high risk people, certainly they already know that they need to have some plan to treat COVID-19. It's best to have a pulse oximeter so that you can monitor your oxygen levels. It's best to have blood pressure, device. It's best to have a nebulizer machine on hand. It's best to just be ready, right? Have that kit and to print out all the directions and ask all the questions. Imagine that you just started getting sick and you go to your COVID kit and you're like, okay, what am I going to do first, right? What am I going to take? What are the directions? Do I understand them, right? You have to go through this as if you're about to do it and make sure all your questions are already answered. So that's important. But even for people who are not high risk, technically high risk for hospitalization and death, especially 30 to 55-year-olds, I see tremendous amounts of long COVID. And long COVID can be a life-changing thing. It can be like chronic fatigue, or it can be chronic confusion. It can be chronic pain, or it can be chronic, shortness of breath. It can be chronic exercise intolerance. I mean, it can be really severely life-changing, and extremely rare to see it in teenagers, although I have seen it, and pretty severely in some cases. I've never seen it under 10. But I see a lot of it 30 to 55, and especially people who are actually really healthy to begin with. So just being really healthy is not enough, right? So you can't just stop at making sure your weight's good and your D level is good and everything like that. You have to realize this is a bioweapon, okay? This is not a normal virus. This was engineered in a lab, most likely, and it's really kind of a strange illness that does strange things to people. And we don't know what it's going to do in 10, 20, 30 years to people who had it and didn't do everything that they could to treat it. We just don't know. We don't have that long-term safety, long-term data on COVID-19 yet, just like we don't have it for vaccines. The only thing we have long-term safety data for are these off-label medications, right? They have great safety profiles. They've been around for 20, 30, 40 years. And we've used them a lot, and we know what they do. So it's important not to discount COVID-19. Even if you're not high risk, you should still have a COVID treatment kit. And at the bare minimum, start ivermectin on day one. I would recommend actually ivermectin and fluvoxamine are the bare minimum, because almost no one who takes ivermectin, I don't know of anyone who takes ivermectin and fluvoxamine on day 1 or 2 and develops long COVID or gets hospitalized or dies, right? That just doesn't happen. And so I've never seen it. No one who's prescribed it has ever seen it, right? I don't know of anyone, right, in this industry who's seen somebody who took ivermectin plus fluvoxamine before day 3 and ended up getting worse. Even we didn't see anyone get worse from day 2 or from starting it. We didn't see anyone end up in the hospital. We didn't see anyone have long COVID, right? So just remarkable outcomes if you're ready to go and you can start treating on day 1. And then practically speaking, the only way you can start treating on day 1 or day 2 is that you assume it's COVID-19 before it's proven to be COVID-19. You start feeling as though you're under the weather. You start feeling as though you're getting a cold, or it might be allergies, or it could be anything. It could be a lot of things. It might not be COVID-19. Maybe you haven't lost your taste or smell. And you just go ahead and treat it. That's really the safest approach, is to assume until proven otherwise that it's COVID-19. You can test it too early. You can test it too late, right? So tests aren't super reliable. Certainly, if you have bizarre loss of taste or smell, there's no other diagnosis it is COVID-19. So, but you don't want to wait. You don't. I get a lot of people who are just waiting. They're waiting too long. And like I said, time is your life with COVID-19. It's not necessarily saying that it's the end of your life if you wait, but it could be life changing. And I've seen so many people with long COVID who just never get back to normal, right? Even with treatment, some people get 90% normal, right? 95%. But again, what's the long-term effect of having long COVID? What's the effect on your health span if you take it out 20, 30 years? Even people who don't think they have long COVID, it's possible that there's a decrease in their health span that's not going to be apparent until 20, 30, 40 years down the line. It's possible that there's a drop in their organ reserve, right? Everyone's organ reserve capacity, right, drops as they age at a normal rate, right? So your lungs have a certain capacity, right? You can exercise to a certain amount. You can pull in a certain amount of air into your lungs and process a certain amount of oxygen as a child, and that ability drops as you get older, right? The power of your lungs drops. The power that's inherent in your heart and your liver, every organ in your brain, it's all going to drop slowly as you get older. If you remain healthy until the end of your life, that reserve is so high that you never hit it, right? Like no matter how sick you get, you don't get to the point where your liver fails, right? Where it stops working enough to keep you alive. Like there's always this reserve capacity, that is there for in the case that you get sick, right? Like what is that reserve for, right? Like it's for, like right now I'm sitting here, I'm not using much of my lung capacity, but I might want to start jogging, right? And then I use a little bit more, or I might might want to sprint away from a lion, right? I'm going to use maximum amount of lung capacity. But you also depend on that when you get sick. Like if I have pneumonia, I'm breathing like 30, 40 times a minute, I'm using up some lung capacity, I'm using up some heart capacity, this extra capacity that I don't normally need to use. And it's like being, jogging or running or being on a marathon for days and days and days, right? And the people who don't have that capacity, they end up dying, right? And the people that do end up living. And so this is what you see with COVID. If people are already sick, if they don't have a great lung capacity or heart capacity, they can die from COVID-19. But the people who do have good capacity and they get COVID, we don't know how much damage has been done to their lung, heart, liver, kidney, brain, to their organ capacity from COVID-19 if they never really push themselves, right? So if you're an elite athlete and you get on that treadmill and you're hooked up to all these wires and they're monitoring everything and they know exactly, what your VO2 max is or whatever, if they never really if you never checked, you're not going to know, So a lot of these people who think they got through COVID-19 fine actually did not. And they may never know, right? Unless they check and what's going to happen, 30 years down the line, all of a sudden you start, wearing out, your body starts wearing out. You're not going to know that it was COVID that did it. So I think people need to realize that even if you're low risk, take it seriously, take a treatment course to try to prevent long COVID.
And be prepared. So I have a couple of questions also from the audience, and there's some great comments that I want to read out also. But one question we had is, what are your thoughts on the new variant, on the Omicron, and is prevention different for this one than the other ones?
So prevention is the same. At this point in time, we're recommending prevention twice a week with 0.2 milligrams per kilogram ivermectin. Again, you can get all the data at flccc.net. We just don't know yet about Omicron, right? Like for all intents and purposes, it seems to be, more easily spread. It spreads really quickly and it's less severe, which is what we expect from the way that a virus would normally develop in the wild, in the natural world. We would expect that it becomes more and more easily spread. It spreads easier and easier, but it's less and less severe. It's killing less and less people because the virus, it wants to survive, right? And it wants to spread to the entire population. So there's this kind of evolutionary impetus that's leading it to become less severe but more easily spread. So turning into a common cold basically is what we should expect. COVID, normally without interference, a pandemic of a coronavirus should turn into like a common cold if you give it long enough time, right? If it goes through the population, maybe it kills the people who are high risk, and then it just becomes less and less severe. And that appears to be what's happening with Omicron. But the problem with all these variants is that we never really know the full story, in the beginning. And again, we don't really know about long COVID. Long COVID is not being tracked properly. So I don't know whether Omicron is worse from a long COVID perspective, better or the same as Delta or Alpha or all the other variants. And the issue with COVID-19 has always been that it seems to kind of unpredictably hit some people much worse than others. So, you would think that one person is low risk and all of a sudden they die from COVID-19, right? So there's always that risk of something like there's a risk factor that we can't quantify in some people, which is concerning, right? With all the variants of COVID-19. And the other issue with the development of the variants is Gert Vanden Bosch's hypothesis that, immunizing people with a leaky vaccine in the midst of a pandemic is going to actually drive the creation of variants that are more infectious and worse, actually, not less severe, but actually more severe. And for a while, it seemed like that was happening with Delta. And I mean, Delta is still going through the country in the U.S. I mean, the rates have dropped, but they haven't actually gone back down to baseline. So Delta is still a major problem in much of the world. And there are hundreds of variants, right? Like there are just so many variants of COVID-19, and there are variants of variants, right? And
Right.
so when you have vaccine immunity coming up against COVID-19, basically the variants that are going to escape are the ones that can evade vaccine immunity. So this is one issue with vaccines that give you a very specific kind of immunity to just one element of the virus. So Omicron, the reason that it may be dangerous is because the changes are like 20 plus changes in the spike protein, which is what we're vaccinating against, right? We're vaccinating against a certain type of spike protein from alpha, and now we have a completely different looking spike protein with Omicron, and this is probably this development has probably been driven by the vaccines, and whether or not it ends up being worse, or not for the world is still unknown. Certainly, the people who first discovered it in Africa, I mean, they were reporting that it's very mild. We're not seeing any deaths, but that's one person's experience, and so this brings up the fact that I've talked to people that I really trust and that I know would not lie to me, and I've talked to them and they tell me that I'm everyone who's dying from this, they're unvaccinated, right? Everyone who's in the ICU is unvaccinated, and that's their experience. And the reason, and other people will tell me the exact opposite thing. In their hospital, primarily vaccinated people are dying, right? And primarily vaccinated people are coming in with illness and getting really sick from this. And you just have to understand that like things aren't like diffused equally around the world, right? So you're going to have this lumpy character to infections, and the only reason that that's a problem is that only one side of this equation is getting universal play in the media, right? So the media is finding those doctors who've had the experience that is in line, it falls in line with the agenda that they want to portray, which is that everyone must get vaccinated and only unvaccinated people are spreading this and dying from it. So we're going to have a bunch of people up on CNBC saying that in my ICU, there's no one who's vaccinated. I haven't seen a single vaccinated death from COVID since we started vaccinating. And it's not like they're lying. It's just that we've selected those specific people. And, again, what's happening behind the scenes? Let's not be, naive. They have something called HARO, Help a Reporter Out. It's a website. You can go check it out yourself, where like physicians and different experts can sign up, and reporters will email you like every day. You'll get this email full of like hundreds of requests from reporters. I'm looking for somebody who has treated COVID-19 and they've seen XYZ, right? So like there's a certain agenda that's being requested, and people who have seen what they want you to see will be called up. They'll be quoted in newspaper articles. They'll be brought up on CNBC to talk about their experiences. And so we're just getting this one-sided story that is, and it's kind of like statistics, right? Like Mark Twain said, like he has this, he talks about lies, damned lies, and statistics, right? Statistics are worse than lies. I mean, you can basically quote unquote prove almost anything you want with any statistical data that you start with. You can just torture it into any position, any kind of shape that you'd like. And this is what we're doing with mainstream media. We're taking reality and we're just like warping it to our will to show what we would like to show, from it. And this, I mean, the media does this with everything, not just with COVID-19. And so this is one of the reasons you got to really kind of unplug and actually seek out sources of alternative media to be able to get kind of like a complete picture of reality, So there's people on Twitter who keep posting, right, like these videos of people all over Europe protesting against vaccine mandates, like thousands and thousands, hundreds of thousands of people protesting against vaccine mandates, and you never hear a peep about it in the media, right? So the media doesn't want you to realize that everyone else is up in arms about this, and you should be too, right? So we have a distorted, warped view of reality, and it's really, Orwellian, and it's really, if you read 1984, it really feels like we're living in that world. Where reality is, whatever the state wants it to be.
Yes, and speaking of distorted reality, it's important to. I just have so many thoughts running through my head. It's just, I think the best thing to do is just go with some of the comments, and then I kind of lead into what I had to say. So we have a comment here that says, doctors should be capable to learn how to properly treat COVID patients. They should stand up, otherwise they are complicit to the crime, and that there's no excuses. So many people are fighting. They're fighting back at the cost of their jobs and even their life. And that's what I wanted to tie into. It's like there are people, I mean, it even happened to me yesterday or the day before. I posted the flyer for this event and my account was just taken. No warning, nothing. And people are sacrificing their careers, they're sacrificing their livelihoods to stand up for what is right. And so that's an encouragement from the public, and we have a pharmacist here because if you don't stand up, then you're contributing to this warped sense of reality that you're talking about, right? We have a pharmacist here who she's saying, I'm a pharmacist and I filled a script for ivermectin a few weeks ago where the doctor felt the need to add to the notes that it was intended to treat scabies and not COVID, which would be inappropriate. And that's really quite unfortunate that everything's becoming so political. We have somebody here also just kind of tying in when you were talking about your website that said, I received ivermectin from Teledoc Dr. Haider, found through FLCCC. It was easy, straightforward. Absolutely, we use this service again. It's just so you guys know that people are using this. There's so many great comments here, like I don't even know where to choose from, but let me see. So many my friends are starting to hesitate the vaccination because of the resistance of doctors and nurses. Everyone should think about their professional oaths at this crisis. That's really, really important. I mean, you guys, professional, and this is a big reason why we created this series. And, we have a lot of medical professionals in our community, in the Muslim community. You took an oath, and when you're taking an oath, this is in front of Allah as well. It's not just the government, and so on and so forth. You have an oath, and you need to stand by it. We trust you. There's some of us who have fallen. A lot of women, in childbirth and stuff, they realize how systemized everything is when they get put into procedures that they don't intend to get into in the first place. It's like it's created in a way where this is where you're going to end up. And they start to question the oaths, like, you're not sticking up for me. You don't actually have the best benefit for me. So you need to question yourself as a physician, and this is what a lot of the comments are about here. There's people who say I couldn't agree more, So Dr. Muzzin, do you have any input on these comments? Because I know you're getting these comments too. So do you have anything to add to this before we wrap up?
Yeah, mashallah. I mean, if I can just say first and foremost, there's a comment here that says, what a breath of fresh air to have someone like Dr. Syed here speaking. And so I really want to just reiterate that and highlight that and say thank you, Dr. Syed Haider, for coming on and sharing with us your experiences. It's often that people from, again, my world of the naturopathic, holistic, hikmah kind of perspective are speaking, and people are aware of that and they're leaning into kind of listening and reaching out and finding us. But it's not often that we have a full-fledged, licensed, board-certified MD who's fully trained, fully genuinely informed by the medical establishment, by his own experiences in the medical system, be able to step out from that and to speak clearly, lucidly, articulately, courageously. And I really just want to give Dr. Syed Haider my heartfelt thank you on behalf of everybody, honestly, because there's so many people out there that are feeling so let down by people like your colleagues in the MD, allopathic, DO world, where many of them don't see it. Many of them do see it, are afraid to speak, and that's okay too. But it takes something really special for someone like you to step into the light, right? To step out into the public sphere and be so courageous. And so I really wanted to say thank you.
Yes, alhamdulillah. I want to express my gratitude as well. This has been so it's been such an enjoyable conversation. And also you touched into nutrition and really kind of highlighted also the faults, in your training as an MD where we're missing and kind of just brought it all together. What I really loved about this is that we're bringing together, it's like Dr. Muslim would say at the beginning, we're not against allopathic medicine. We're trying to really bring it all together and work in unison, It's just really refreshing. Alhamdulillah.
I think just one last thing I'd like to say is that, the first thing everyone needs to realize who's listening to this is that we have responsibilities, right? And your primary responsibility is, first of all, to yourself and your own soul, and to give yourself a long and healthy life so that you can worship Allah subhanahu wa ta'ala, as maximally as you can, with all of what Allah has given you. And so Allah has given you, your body and your mind, and you need to protect it. And so, patients' responsibilities are first of all to themselves and then to their family, right? So if, we all have responsibilities beyond ourselves. I need to take care of my wife and my children and my parents, and the wider community. And if I get sick, and if my health span is decreased and my lifespan is decreased, then I won't be able to take care of those responsibilities as well. And so we all want to maximize our health span so that we can continue to take care of the responsibilities we have to ourselves and to the people around us as much as possible while we're alive. So this is, personal responsibility that you have to take for yourself. When somebody comes and tells you that there is a treatment for this deadly disease out there that can harm you, irrevocably harm you or kill you, you need to take the time out to go and research it and to get the kit ready for yourself if no one else does it for you. And then after that, you start telling other people around you, try to get this thing ready for your children and your parents and your siblings and the wider community, and spread the word. And then, all of humanity, we have a responsibility to everyone in humanity and the entire world. But we have to begin with personal responsibility first.
Absolutely, 100%. All right, so this brings us at 2 hours. I'd like to thank you so much, Doctor, for coming here with us. Somebody did ask, is Dr. Haider coming again? And inshallah, we're planning, to have him again. We have so many topics that we need to cover. I know you guys had a lot of questions on vaccines. This was more of a firsthand experience. There's definitely an opportunity to get all, into all those great details, inshallah. So I just want to let everybody know also, thank you so much for coming and sitting through and asking your questions and participating. I just want to remind you that you're going to be sent a replay if you signed up to, balancingtheconversation.com. You're going to be sent the replay to your inbox. And if you have any questions, please submit them to questions@balancingtheconversation.com. Let me just pop up the little banner here to show you, just make sure everything is spelled out properly. And inshallah, we should be having an episode next week. If not the next, but I will keep you updated via email. So again, thank you so much. Dr. Mazin, would you like to close the session with a dua?
بسم الله الرحمن الرحيم الحمد لله رب العالمين اللهم صل على سيدنا محمد عبدك ورسولك النبي الأمي وعلى آله وصحبه وسلم اللهم إنا نسألك الهدى والتقى والعفاف والغنى اللهم إنا نسألك التوفيق والإخلاص ودوام النعم وحسن الختام اللهم اسمعنا خيرا واطلعنا خير وارزقنا اللهم العافية وأدمها لنا واجمع اللهم قلوبنا على التقوى ووفقنا لما تحبه وترضى ربنا لا تؤاخذنا إن نسينا أو أخطأنا ربنا ولا تحمل علينا إصرا كما حملته على الذين من قبلنا ربنا ولا تحملنا ما لا طاقة لنا به واعف عنا واغفر لنا وارحمنا أنت مولانا فانصرنا على القوم الكافرين اللهم أصلح أمة سيدنا محمد اللهم ألطف بأمة سيدنا محمد اللهم ارحم أمة سيدنا محمد اللهم انصر أمة سيدنا محمد بخير ولطف وعافية يا أرحم الراحمين سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك Assalamu alaikum, everybody. Thank you again for attending. And thank you, Dr. Syed.
Alaikum assalam.